what's the biggest myth that you're here to debunk that everyone believes with physical therapy?
People think that they are what their image is because they'll come to me with their image and say, Dan, my MRI says I have a disc bulge. So I got to have this like terrible pain. I'm going to be in agony. I probably need surgery. And that's the myth that we try to debunk left and right.
Welcome back to the Primal Reset Podcast. Today, we're joined by Dan Luczka, the founder of InstaCare Physical Therapy. Dan has built a patient-first, one-on-one model that's helping active adults and athletes recover faster without meds, injections, or surgery while scaling across multiple locations in Pennsylvania. Dan, it is a pleasure to have you. Welcome to the show.
Thanks, Elliot. Happy to be here today.
So, Dan, walk me through a quick 60-second intro about yourself. What got you into starting InstaCare and what's your background?
Sure. So, like you said, started InstaCare Physical Therapy. Happened about 7 years ago. I was working in a traditional practice, but it was very busy, multiple patients an hour, and I just didn't feel like I was giving the quality care that I wanted to give my patients. Nothing out of the ordinary. Now, I think I was a little bit too naive to know how much work it'd be to start up your own company, but I just went for it, and I'm a grinder, so every day I just grinded, and now I look back 7 years later and I'm here. Never had any business experience, never took any business classes. I just wasn't afraid to fail and maybe a little thick-headed, but I think I use that to my advantage.
I love that. And so kind of diving quickly into the business side of things, what challenges did you happen to come across when you were starting InstaCare, and how were you able to overcome it?
I mean, the biggest challenge is just knowing what I don't know, because it was just so foreign to me to start a business. I didn't know the first thing about how to even get an LLC, right? So I went after a YouTube university, right? So much of what we want to learn is on YouTube. So I just became addicted to it, and I just learned, and I would pick one task to do a day, and I just did it. I don't think I did anything special other than I'm good at being consistent. And I just did that. So the first challenge, knowing what I didn't know. 2-ish years into the business, COVID hit. So we had to have that challenge, which actually came out on top. 6 months into COVID of the shutdown, we actually opened our second office. So I can dive into that more, but that helped us boom a lot. And I would say our biggest challenge today is actually talking to certain physicians because we have a very specific model. A lot of physicians send their patients to their own physical therapy practice because they make more money and they send it to their business. So we're now having to communicate to them why they should send them to our company versus their own, even though they make more money there.
And tell me a little bit about your model. We see so many physical therapy offices, and we've had this for such a long time. What makes you guys different?
Absolutely. So we have a couple unique services that we do that no one else in this tri-state area does. So one of them is we have on-site imaging with diagnostic ultrasound. So a lot of people know ultrasound when they look at babies in the mom's belly there. Well, we can use that to look at your muscles, tendons, and ligaments. So let's say an Achilles issue, right? I can image you on site and tell you, is there a tear or is it tendonitis or what's going on? Saves you from having to go to your primary care physician or ortho. So money saver, time saver, gets us more accurate. We also do a lot of dry needling on site that looks like acupuncture, but it's Western evidence-based medicine. Now there's other people dry needling more in the area, but we do it under ultrasound. So when you're putting the needles in, say to the Achilles area, which you want to help with tissue regrowth, we'll do under ultrasound to see exactly where we're going. So we're extra targeted, which is not very common. And the other two things is that we're one-on-one for a full hour with experienced clinicians. So we don't have any new grads. Everyone is about 7-ish years out on average. And our model approach is that we're going to empower you and teach you what you need. So therefore we can get better in fewer sessions versus having you rely on us, which I think is a model for many other practices. And I feel like that can be a little salesy at times.
And how big of a positive impact have you seen going to the one-on-one model, being able to spend a minimum of an hour with every single client?
I mean, huge, because one thing I've noticed different in this model is that my patients trust myself and my team with things outside of the PT realm, right? So we've had patients come to us and say, look, I have this issue, not even related to physical therapy or musculoskeletal, but I want your opinion before I go to this other person for it. I've never experienced that in other jobs, and I talk to my staff and they haven't either. So I think in this model with that real high quality one-on-one, our patients know us, like us, and trust us. And even if it's not PT related, they still want our opinion on it. So I think that speaks volumes to what this model can provide to them.
I love that. We've definitely gone in a place of, we had that model way back when, going into more of a prescription-based model of I'm going to spend a couple of minutes with you. I'm going to give you a prescription for whatever it is. If I have an Achilles tear, here's a pill that's going to make sure that you're not going to feel any pain anymore. And we'll see you next week. Uh, to the point, kind of going into more of what you guys do. Everyone thinks prevention means stretching. And is it more than that?
Yes. Capital. Yes.
So what rehab hack do you have that most people dismiss on that aspect?
Yeah. So two things we like to push for preventative, and we're talking preventative for musculoskeletal injuries. Now, separate conversation is that some things, we'll have pain in life, separate conversation, but what can we do to decrease the risk of that? Resistance training and dynamic stretching or dynamic warm up. So going off your stretching comment first, they've done a lot of good studies now with static stretching, just like holding a calf stretch against a wall for a few minutes versus dynamic stretching, doing some more motion with your calf to get it looser. Hands down, the evidence shows dynamic stretching is the way to go. A cool example of this is if you're familiar with the NFL combine test that they do every year, right? They'll do certain like running drills, sprinting drills, and jumping drills, right? So they have some objective, right, on how fit they are in that stuff. Well, what they did is they took a group of individuals and they did static stretching first and then repeated that test. And they actually lowered their scores performance-wise. Then they took another group and did dynamic stretching for the same muscle groups, redid the NFL combine test, and they improved their performance. So static stretching doesn't really help us decrease risk of injury, and it decreases our performance. But dynamic stretching helps increase our performance and reduce the risk of injury. Now, that being said, it doesn't mean we can't do any static stretching, but it definitely should not be your bulk. I can go into a ton of detail on how that's more beneficial, but that's the main point, is dynamic stretching or dynamic warm-ups are far superior to the static stretching to prevent injuries.
So in layman's terms, more movement when you stretch is better for not just your body to perform better, but also to help prevent those injuries. When we talk about static stretching, it's the stretching down all the way to your toes, touching your toes. It's the, pulling your leg up behind you and stretching your quad. It's the, the arms getting across your chest and just pulling. What does that really do inside of the body that allows the body to underperform?
So without getting too technical, there's certain nerve sensors in your muscles called muscle spindle fibers. So if I'm a pitcher, right, and I want to stretch my shoulder out, I'm doing this stuff, those muscle spindle fibers feel that stretch and they want to loosen. So, okay, I got more motion. Doesn't sound bad, right? But then when I go to add velocity and speed to it and some ballistic motions that pitch, the muscle is just in that loosened state. It's not good at contracting and relaxing, which we need for the actual sport. So we don't want to stretch. Like, you ever do a split and you're trying to do a split and you're down for a while, then you go to stand up. It's really hard to move after. It's kind of like that. You have that range of motion, but your ability to use it in a performance setting is diminished because you can't then pull it back and contract and relax. You're just in that loose state.
So if we're going to more of an average person that's going to the gym, and when they're stretching beforehand, what kind of stretches should they do?
So we want to make sure that depending on the body part, that would vary, but we want to make sure their heart rate's up. If you're going to go lift some heavy weights, your heart rate's going to be up for that, right? And your nervous system's going to have to communicate really strongly with your muscles on how to, say, do a big bench press, right? Well, we want to mimic some of that prior to. So my dynamic warm-ups, say before a bench press, is going to be something similar motions-wise. So I'll get my full range of motion of what I want to do. I'll also add a speed component to it. So my heart rate's getting up and my nervous system's getting used to firing those muscles more quickly, which is the exact demand that I'll have to have in a few minutes.
So spending 20 minutes of warming up, just doing these static stretches every single time is not as beneficial as we've been told to be for such a long time.
No, but I think it's beneficial for the businesses that treat it, but not for the athletes that want to stay pain-free in the gym.
There's definitely a market for all of that. My last kind of question for this, and just for the gym goers out there that are trying to build muscle, there have been studies showing that staying in a more stretched state on like lifting that weight or using that cable or whatever that exercise might look like will help build more muscle. Is that true? Or do we need those contractions mainly?
If I'm understanding that correctly, I'll go over the bench press example for a second because everyone can visualize that. If we want that stretch state, so if I'm bringing the bar all the way down, yes, I will get more of a load on those fibers. So the adaptation will be stronger and better. So with that alone, yes, we can grow more muscle through a fuller depth, a larger range of motion. Absolutely. There are studies that even show with just squats, doing lower depth squats help increase your growth or hypertrophy better than other squats. If you're not going full range there, we'll get more of your muscle fibers and stronger and better adaptations.
Okay. That's reaffirms what I'm doing in the gym. So I read this study. I figured I'd try it. I'm not quite as built as I want to be, but definitely outside of being an athlete, it has helped me gain a little bit more muscle, which I love to hear that as well. Going on the side of after the fact, so not necessarily prevention, but what would be a better way when you work with clients to be able to get them through their rehab? Are we doing dynamic stretches? Are we doing static stretches? What's your focus?
Great question. I'm going to even backtrack it for a second for when the clients get to us, because the evidence is huge. If you get to a physical therapist, Intel, the computer company, they did a retroactive study with 30,000 of their employees, just looking over the records over the years. When their employees got hurt, if they went to a PT within 48 hours versus 2 weeks, their recovery was a game changer difference. So much better. Got better sooner, less overall healthcare costs, less missed work days, and they needed fewer visits with the PT to get better. So before they even get to our office, we're trying to educate the public on come to us within that first 48 hours of an injury versus the 2 weeks. Now, some people will say, I don't want to cry wolf. I don't want to go for every little thing. Totally get it. I wouldn't want to either. We do phone consultations before you come in so we can say, you know what, this doesn't sound that bad maybe after talking with you, but at least got a professional on the phone. So maybe we'll see you a little bit later, but at least talking to someone within that first 48 is huge. Timing is everything. I'll start with that. Once they're in the office with us, we want to see what their routine normally is. If they're just doing static stretching, let's change it up. Some of our athletes are high-level athletes, Ironman athletes. They're doing great dynamic stretching, but sometimes not enough of the resistance training as well. So as we're calming down their injury and fixing that core root, then we have to talk about how to do proper resistance training to strengthen those tendons, ligaments, etc., so that thing doesn't come back. We kind of describe it as it's giving your body extra armor if you can have thicker, stronger tendons and muscles and ligaments there.
Interesting. I love to hear the other side of it. I mean, I've gone through PT being an athlete myself for many, many years. Is there a certain technique that you guys like to use better, have seen better results from? I mean, I know I've used electroshock therapy. There's also obviously stretching and dynamic stretches that resistant training that I've also been through in order to help my rehab. But what would be the top one you've seen the best results for?
So it can vary a little bit injury to injury, but if you don't mind me asking, what body part or region were you going to PT for?
My knee.
Okay. So go off the knee there, right? So again, it could vary in diagnosis, but let's just take a general, say a jumper's knee or a patellar tendonitis, having a little pain below your kneecap there. Well, first off, dry needling that area is great. Again, dry needling looks like acupuncture, but it's Western evidence-based medicine. The dry needling can help that area decrease inflammation. It brings the fibroblast cells, which are the healing cells, to that site to help it repair itself and decreases pain levels. So great there. But then think that knee hurts. If you're coming into me saying, Dan, I'm just doing air squats and that hurts. Well, it's really hard to strengthen you when just air squats hurt, right? But I want to speed up your progression. So what we use is something called BFR, or blood flow restriction therapy. Did you see that in your office when you went?
At the time, I don't think we had one, but I think it was
Fair.
starting to become more and more studies out. So I think we
Absolutely.
started utilizing it towards the end of my career.
Very cool. So we use that all the time for people. So the very short explanation of that is it looks like a blood pressure cuff, and you put it either on your upper arm or upper leg for your knee, and then it just tightens itself. So when we let some of that venous pulling occur, your body swells. You get that pump, right? Like we all work out in the gym for an hour, we get that pump. We love it. Well, we can give you that pump within 5 to 10 minutes. While that's on your leg for your knee, we can do very simple exercises that really don't load the knee that much. And we can still get hypertrophy or muscle gains with that without doing those air squats. So an example would be laying on your back, maybe just lifting your leg up and down, which for, young, healthy guys, no big deal. You're not really strengthening much. But when you put the BFR cuff on, you are getting the strengthening and the hypertrophy results. So a lot of our sessions look like a lot of dry needling, hands-on techniques, and then doing some sort of BFR to help with the strength gains, especially in the beginning when you really can't load that joint.
It's wild to see so many different techniques and almost introducing technology with the older side of medicine that we have used in the past to just maximize what we can do for the body. My last question about the injuries and rehab and the preventative side, what's the biggest myth that you're here to debunk that everyone believes with physical therapy?
So there's something I get a lot coming into me. So hopefully this answers the question well, but people think that they are what their image is because they'll come to me with their image and say, Dan, my MRI says I have a disc bulge. So I got to have this like terrible pain. I'm going to be in agony. I probably need surgery. And that's the myth that we try to debunk left and right. There is so much evidence out there nowadays. And I don't mean low level evidence, high quality systematic reviews that show, say, the bulging disc. A lot of people have bulging discs and they're pain free. So we're trying to debunk the myth that just because your scan or image says arthritis or says a bulging disc, most people have those things and they don't have any pain. And it's not even associated with their condition. Now, it definitely can be, but we have to do other investigative work to see how much that does or does not relate to it. So number one myth I want to debunk is that you are not your image. That is just a small piece of the puzzle for you.
I love to hear that. I love to hear that. It's definitely, even just what you look like on the outside is not what's going on the inside.
Absolutely.
So I deal with this. I sound like an old man saying this, looking like a young person, but after retiring from a sport that I've played for 14 years and kind of stopping cold turkey, no more dynamic stretches, not the active workouts I was doing, not being on the ice every single day. My hips, my knees, my back has completely given out on me. And that's completely on me for not taking care of that more. But there are some times where lifting heavy things I need help with. And I'll always get that, oh, you're in your 20s. Like, you're a young kid. You should be able to do this. It's like, well, for me, I didn't take care of my body after, but also playing a sport for so many years has definitely gotten that wear and tear on my body as well.
Absolutely. And it's hard because as you're going through those sports there, I don't think there's often a lot of talk about how to help yourself longevity wise. We're so focused on the next game, the next practice, or just that one season, not as much as, how do you make your career last 10 plus years and how do you feel good in later decades of life as well. So definitely something we're trying to throw into some of our younger athletes to have them think ahead, which is really hard to do when we're younger, but definitely pays dividends in the long run.
And hopefully that'll catch on sooner rather than later. I think we're definitely at that curve where we are going to start seeing more people have that awareness and have that knowledge from the education that we put out every single day to try and live a better life in the length of it, right? We always want to be the rabbit. We want to finish the race first, but we got to think of the tortoise. Like, the tortoise
Absolutely.
is eventually going to win because the rabbit's going to be exhausted at one point. He's going to be cocky. He's not going to be able to finish that race as consistently as that tortoise is. At the same time, for athletes, we want to make sure that tortoise becomes a rabbit, but for a longer term, as opposed to that short burst of energy, that short burst of muscles and all that as well. Going back
Absolutely, I love that analogy.
well, thank you. Thought of it on the spot, but well, going back into kind of InstaCare, we see telehealth, physical therapy, we see corporate wellness webinars, educational content. What role do they play in the future of rehab and InstaCare's long range plan?
Easy answer. It's accessibility, right? Like, why do we like Amazon Prime? It's accessible. You click something, it comes to you right away. We want that instant access to items or a specialist. So that's where the telehealth or any of our corporate wellness stuff comes into play. Clear example, I have someone who will go on a work trip. They sleep weird on their hotel.
I'll have all those links in the description below. So if anyone is out there in the Pennsylvania area that wants to go see Dan or InstaCare Health locations, go check them out. If there's anything that's bothering you, even if there's something that is not bothering you and you're looking more of on a preventative side, or if you're looking for more education, go on their website, go on their social media handles, learn a little bit more about yourself, your body, what Dan does at InstaCare, and take care of yourselves. Take that next step in your health journey.